Welcome to the ISMP Medication Safety Podcast, supported by Novartis Rights Creation. My name is Raymond Lowe, PharmD, MBA, and I'm a postdoctoral fellow for Novartis on the Rights Creation team. In this podcast, we will be discussing issues with polypharmacy and recommendations for healthcare organizations. Today, we are speaking to Tyler Nichols, PharmD, BCPS, who is the 2022 to 2023 ISMP International Medication Safety Management Fellow. Tyler, our first question for today is, how would you define the term polypharmacy, and what are your concerns with this issue?
Thanks, Ray. So polypharmacy is actually a term that's been around for a few hundred years. If you looked at it back in 1800, for example, the term was mainly used to describe the treatment of a disease state with more than one medication. Nowadays, we're actually using a few different definitions of the term. So polypharmacy can mean a patient who's taking 5 or more medications, but it's also sometimes used to define patients who are maybe receiving medications from multiple different pharmacies. So in the context of today's conversation, it's going to be a little bit more, actually a little bit of both of those, because it's going to be patients who are on lots of medications, and oftentimes that can be exacerbated by the use of multiple pharmacies. When we think about polypharmacy, we also think about inappropriate polypharmacy. So some patients may require 5 or more medications to treat a variety of disease states. What really is concerning is when you see these patients on 5 or more medications, and upon review, you identify the fact that a lot of them may not be appropriate for the particular patient. Many times these are older patients, in that category of 65 years or older. So as these folks get older, we see changes in their body composition and changes in their renal function and their hepatic function and their just overall cognition that can really make it more difficult to be compliant with a difficult medication regimen. And also you see when there's added medications, increased risk of side effects, increased risk of cumulative adverse reactions and drug interactions. So as we get into these patient populations, it gets to be more and more concerning, and more important that we look at the degree of polypharmacy.
Thank you. And what is the prevalence of inappropriate polypharmacy in the elderly?
So polypharmacy in general is something we've seen increase pretty rapidly over the past several decades. So back in the 1980s, I think the statistics were about 10% of patients over the age of 65 years old were taking 5 or more medications. Fast forward to the past decade or so, and that number jumped up to about 40 to 50% of patients over 65 taking that number of medications. What's difficult to really identify is the percentages of inappropriate polypharmacy, because really that does require that you have an idea of how many patients are on inappropriate medication. So you need somebody to identify the inappropriate polypharmacy, and more importantly, you need somebody to document it. So really, with no true documentation, it's hard to really say what that number could be.
Why is this issue so much more common in the elderly population?
Sorry. So the issue is exacerbated in the elderly population for a number of reasons. A lot of the time it's because they're often seeing many prescribers or many providers. So with the rise of people going to see specialists on top of their general practitioners, you're going to see multiple cooks in the kitchen, so to speak. So they may be getting some medications from one provider who isn't speaking to another provider and letting them know that they're also treating different disease states. So as you see more interactions with healthcare institutions, both inpatient and outpatient medication or doctor's visits, you're going to see an increase in that sort of cumulative acquisition of medications often in this patient population.
Okay. And what strategies or recommendations can healthcare providers take in order to prevent harm associated with polypharmacy?
Yeah, so the number one recommendation here is going to be communication. So it goes both ways. So providers communicating with their patients, and also patients communicating with their providers. So on the provider side of things, they really need to be asking their patients what other providers they're seeing and what other medications they may be getting from those other providers. So really just communicating that medication list is absolutely critical. So taking the time to talk to the patients and go through all their medications, not just finding out what they're on, but finding out why they're on it, when it might have been started, what they know about the medication. Having those sort of detailed communications with your patients about all of their medications is incredibly important. And when you're getting that list, it is really important to really have a scripted type of conversation with the patient, because if you just ask about medications, it's difficult because we in healthcare speak a different language than our patients do. We live in it every day. We spend lots of time learning about working in healthcare. So what's normal speak to us is not always what our patients are understanding. So asking specifically not just what medications you take, but asking about other medications that patients may forget are medications or may not consider medications. So here I'm thinking about eye drops, ear drops, nose sprays, topical creams, patches, lotions, ointments, injectable medications, infusions they may receive. I'm saying this in a pretty rapid way because I've scripted this and I've had that conversation so many times over the years. And the number of patients who actually respond back and say, oh yeah, I do take a weekly injection, or I go to the infusion center every 3 weeks and get something. So really making sure to ask about those things is critical. On top of that, all of your over-the-counter medications, your herbal supplements, your dietary supplements, and specifically when asking about those, it's really important to not be overly judgmental. I know in healthcare we tend to have a tendency to try and push people away from kind of naturopathic medication, but they're going to use it regardless of how we feel about it sometimes. So not being judgmental, they're going to be more likely to share that information with you and not really have a kind of a feeling of shame or so about it. Also, we talk about naturopathic medication. We can also say for providers, it's helpful to really try and stress the importance of lifestyle changes and other types of therapies outside of medication whenever feasible before starting a new medication. And also keeping in mind, before you start a new medication, make sure that the patient's already been optimized on the previous therapy. So, how often are we adding on a second agent for blood pressure or for cholesterol when maybe dietary changes could be further stressed and encouraged, and maybe those doses of the previous agents could potentially be optimized before adding multiple other agents onto the profile. So it's really important to do that, and it's also important to rule out any side effects as part of differential diagnosis with your patient. So before starting a new medication to treat a new symptom or side effect a patient might be experiencing, you want to rule out that side effect as being maybe potentially caused by another medication they're on. So that stacking effect that can sometimes happen when medications are just added on as a treatment to something else that could be causing it. And ultimately, you can also refer patients out to medication therapy management programs. A lot of insurance companies like Medicare may cover that. So having them go out and see a pharmacist to go through and do that, what we used to call a brown bag event, bringing in all your medications, going through everything that you have in your medicine cabinet is a really great way to encourage people to talk about their medications and share that with their providers.
Great. And finally, what steps can patients themselves or families/caregivers take to reduce safety issues with polypharmacy?
So from a global perspective, really being an active participant in your care is one of the best recommendations that we can make for our patients. There's a saying that's used in a lot of different patient advocacy programs through a lot of different organizations. Nothing about us without us. And it's really a great concept to highlight the fact that patients need to be involved in their care, not just be the recipients of care, so to speak. My second recommendation would definitely be that they keep a list. That's number one. So whether it be a piece of paper in your pocket, or if you use one of the possibly dozens or hundreds of available electronic tools that are out there these days to keep an accurate list of your medication, that's incredibly important. So the keys there are accurate and up to date. So anytime if anything has changed, it should be updated. And you should also be bringing that list with you to every point of care. So that should be on you at all times, whether you're going to see your regular doctors for your normal visits, or if you're going into an acute care facility for either a scheduled or emergent situation. You want to have that list with you because that's going to help ensure that you're continued on medications you should be on, and other folks know what other medications they might need to avoid based on your current regimen. And ultimately, one last thing. encouraging patients to use one pharmacy is also helpful. We talked about that earlier about polypharmacy, meaning potentially using multiple pharmacies. And it's more and more difficult these days as we see an increased pressure for patients to get their medications filled through mail order, which may not be associated with their local pharmacy. The rise of specialty medications and injectable medications that patients might be getting through those pharmacies adds to the fact that you might be having patients getting their medications from multiple different sources. So, when possible, recommending that they use just a single pharmacy is incredibly helpful.
Great. Thank you, Tyler, for taking the time to provide all of this information. If you would like more information about ISMP or regarding medication errors, please visit ISMP's and consumermedsafety.org website that is displayed on the screen. If you have any other questions, please email ISMP at info@ismp.org. And this now concludes our podcast. Thank you.